Hi.
We're
As Catherine has said, that I'm a public health person. I've worked in hearing. I was working out yesterday for 42 or more years, and it's my delight today to talk to you about some of the elements of COVID and hearing services. Hearing today and tomorrow, and I put services in brackets because they're very important. The good news, and this is from the Global Burden of Disease website, is that in England, they estimate there'll be 0 deaths from COVID by the end of June. And we hope it continues like that. A similar picture is seen for the rest of the world. So that is good news for the future. I didn't think it would come to that so quickly. Let me see if I can I advance the next slide? So COVID has had a big impact on health services, particularly seeing less people who've got cancer, less people who need diagnosis or triage. So in that sense, the impact has been a secondary one, as well as the primary health effects caused by the pandemic. If we turn to the next slide, not only are there indirect effects like people not being diagnosed or people not being treated, but also the waiting times for diagnostics have been much longer than they have for most ordinary services, whether it's looking at cardiac issues, respiratory issues, urinary issues, or hearing issues. We have data that shows that. And the next slide shows the waiting list for audiology assessments. When I first started working at the Department of Health, the waiting list for audiology assessments was over 1 million. You can see on that left-hand side the big peak, and it goes up to 1.7 million people waiting for a hearing assessment. Thanks to the actions that we all took, those came down, as you can see, to between 20,000 and 30,000 people. But where that red arrow comes in is where we saw the effects of COVID starting to impact, and those waiting lists went up. And so now there looks as if there's over 70,000 people on the waiting list, twice as much as there was maybe 5 years ago. So if we go on to the next slide, it shows the number of people waiting for 13 weeks or over for an audiology assessment. And you can see that in the beginning, when I started here in 2006, there were over 100,000 people waiting over 13 weeks for an audiology assessment. And then you can't see very much from 2008 through to 2019-20. And it's very much in on the 0 or 2000. Quite a lot, but it's very small compared to what it was. And then you can see the spike in all of the diagnostics, in MRI, in non-obstructive ultrasound, in barium enemas, in flexisigmoidoscopy, in gastroscopy, in cytoscopy, and colonoscopy. They all went up, and they've come down. But the good news here is that audiology has come down more than a lot of the others. The green line there shows that actually the recovery from the big impact of COVID has been quite rapid in audiology. Can I have the next slide, please? The impact of the pandemic on numbers of children implanted in the UK is shown in this slide here, and I'm grateful for Sue and BCIG for giving me these data. You can see that about 500 children per year were being implanted between 2013 and 19. And in 2020, as the pandemic struck, there's been a reduction. Next slide, please. This is similar to adults as well, except the reduction, as you can see, is to less than half of what it was in 2018, 2017. So a huge impact on cochlear implant numbers of the pandemic. Next slide, please. So with children, they weren't so susceptible to the impact of COVID, although I'm sure they spread it around hugely. But the impact has been on violence against women and children, and also the mental health of children. So violence against women and children has increased by 20% worldwide and slightly larger in the UK. Next slide, please. So children from marginalised communities are particularly susceptible to the infection and suffer extended ill consequences of this pandemic: child labour, child trafficking, sexual exploitation, and death. So the impact has been big on children. Next slide, please. So that one of the major impacts has been on mental health. And our Department of Education in the UK suggests that there is a 25% rise in mental health problems since the start of the pandemic, and 54,000 more children waiting for treatment. I have some case studies which we could go into later on, but we haven't got time immediately to do that. So next slide, please. So I'm just taking the line from the British Medical Journal editorial from last week. And the headline here is: the challenge is to ensure that the new normal isn't simply the old normal, but even more damaging consequences. We have to take that really seriously. We're reconstructing the same flawed society, they say, that failed to respond effectively to SARS-CoV-2 and failed on climate change and is failing on climate change. And I say also hearing care. The answer may lie in new approaches to incentivise sustainable corporate behaviour, reducing the rich world's consumption, and most interestingly, encouraging degrowth. And this is particularly important in terms of access to vaccination. Next slide, please. So the need for implant services, I've said, in the UK, we know that about 500 children a year are assessed and are given cochlear implants, usually bilateral cochlear implants, but considerably less in pandemic times, a reduction by almost 23%, almost 25%, almost 1 in 4 reduction. So that's huge. And I think the need in older people has been much underestimated. There are many hundreds of thousands of people out there in the UK alone, and millions in Europe, with severe or worse hearing problems, who've got hearing aids that don't help. And we are not offering these people a really important access to implants that could radically change their lives. So I think that the need for implant services is greater than we've ever thought. And we must take this opportunity, call it the COVID opportunity, to reach out and make sure that those people who would benefit from implants actually get assessed and get access to the great technology. Next slide, please. So hearing today and better tomorrow. There's much need in the UK and globally for good hearing care to support people with severe hearing problems and their families. Yesterday, or in 2019, we had a solution. We all know it didn't work well, and we need to build back differently. Yes, we need a workforce that's commensurate to the task, but we also need better ways of working, better ideas for how we take forward a proper digital hearing service supported by the best data, the best IT, the best AI, the best machine learning, a long way from the software that we currently use. Next slide, please. So this is a circle of care that we invented for the Coalition for Global Hearing Healthcare when we were looking at the role of newborn screening. And I think it works really well for adult services, for all services, as well as for newborn screening. And I've stuck some new things in here, particularly at the top right-hand corner. Instead of screening or triage or waiting for people to be referred by primary care, we ought to be going for self-referral for these services, for hearing aids, and yes, for implants. I think that is really important. And when I mentioned this previously, other people have been thinking the same thing, having posters in their hearing clinics, particularly for people with severe hearing loss, to say, have you thought about asking for a referral for an implant? I think that would be so useful for people and a huge value. So as we go through this, on the right-hand side, getting into the system is important, but coming around the system, particularly linking with people who have similar needs and wants, I think that is hugely important, and we don't do it enough. I know that in the cochlear implant field, and particularly in your own organisation, this comes as second nature, to link with people who have similar needs, similar wants, similar services. But we don't do it enough. And I think that we don't share the data and the good practice half as well as we should do. Next slide, please. So, oh dear, I think I've missed a slide. Can you go back one? Right, so this is a slide that Professor Samir Gray used yesterday in a meeting I was at, to say the healthcare for the future will be with systems, integrated care systems, where we have primary care networks, hospital-based networks like ENT and audiology, social care. And what I've suggested is also an international cochlear implant network that thinks about the specifications for the system that's needed, the standards that are needed, and how we measure those standards. Miura is particularly interested in how we get better quality of life for longer life years lived. And I think involving people and having people with lived experience specifying those services is hugely important. Next slide, please. So what would that look like? I think that international network should be led by people with lived experience, supported by many professional networks, and refined criterion for self-referral, with better, more accurate, validated triage of self-referrals. Not screening. Screening is about finding people who don't have symptoms. But we know, and people know, when they've got severe hearing loss. And so what we need to do is triage those who will most sincerely benefit from cochlear implants. I think it's the last slide next, is it? So thank you, Sue and the committee, for asking me to speak. For my daughter, Katrina, for inspiration and some of the data, Sue and Brian and BCIG for that data, which is incredibly useful. And thank you all for listening. And if you have any queries after the meeting and that don't come through Brian's chat, then there's my email that you can email me on. Thank you very much. I'm sorry to have had technical problems at this end, and I hope you heard me.
Lovely. Thank you so much, Adrian. That was absolutely brilliant and inspiring. Now, Brian Lamb is standing by on the chat room, and if you have any comments or questions you want to pop in the chat room, then throughout this presentation, Brian will be able to bring those to light. Brian, is there anything you want to raise now?
Yeah, Kathy, thank you. A really interesting question from Robert Mandara. Adrian, as you know, in a way, self-referral has been the sort of holy grail, certainly for hearing aid users and perhaps also for cochlear implant users. But Robert's raising the question that for many people with profound hearing loss, they won't even know that cochlear implant is an option. So how could we address that as part of the building back differently?
Yeah, and I think that Catherine's got part of the answer there, is that we have to have education campaigns, particularly in the clinic, to make people aware of those options. If we don't do that, I think that is, we have to sit down, professionals, educators, and people with severe and profound deafness, and specify how we get that awareness increased in the population. So I think it's a co-design, co-production issue, I think, Brian, myself.
Brilliant.
And it's hard
the co-production bit is very important. And at CIICA, we're going to come on to look at that whole issue of co-production in another different session. But Adrian, thank you very much for that. Really interesting.